Yes, on Invicta 98.9. Today is Thursday, and like we do it every Thursday here, we are with Kaduna State Ministry of Health. They are the ones that are bringing this program to you. And so what we're talking here is about COVID-19, where we are with it globally and in Nigeria and coming back home to Kaduna. Well, we all know what is happening in the country today, and of course what is making waves and is on top of the flask now is the End SARS protest. It's all over the place, and of course we are finding a way to calm down nerves, and of course calm down angry irate youths on this matter. But again, COVID-19, with the protocols that we have on ground, it's saying that social distancing must be part of it, wearing of the face mask must be in it, coughing into bent elbows, and of course washing our hands with sanitizers, and all of that, what the protocols are saying. But with the End SARS protest, what we're saying is a multitude of young men and women were out there on the streets, and again, concerns that we just might be giving COVID-19 another chance to spike off, so to say. The world is battling with it as it is now. We haven't had a vaccine for it or a medicine to take care of it. The situation in United States of America and Britain and of some parts of Europe is saying that COVID-19 is just still with us. And so countries of the world are taking every step to see to it that they keep their people safe. And back home, it should be the same thing that we're talking here. The NCDC has come to say that we are not free from COVID-19 too. It's up and it's on the rise, and so we must take all the steps that we can. And of course, the steps will be keeping to the safe, to the protocols, the measures put in place that can keep us safe from COVID-19. This morning, I will be talking with Dr. Elias Neyu. Dr. Elias Neyu is of the Primary Health, Kaduna State Primary Health Center. Is a member of the COVID-19 in Kaduna State, and of course, in the position to give us the update, and of course, Nigeria and back home in Kaduna, what we must do, continue to do to keep ourselves safe. Dr. Elias Neyu, good morning, and glad to have you on the program.
Good morning.
Yes.
It's a pleasure to be here. Just that I can barely hear you. You seem to be distant from your device. No?
Yes, I'm with you, Doctor.
That's better. Thank you.
Yes, okay. And I was just giving a background out there about what is happening the world over, and coming back home, especially emphasis on the hashtag End SARS protest, the multitude that we see on our roads, and of course that all protocols in place for COVID-19 to keep us safe. We can see it's there that none being observed. Face masking not there, social distancing not there, and again concerns about the End SARS protest on keeping us safe from COVID-19.
Yeah. So that's a good observation, because that is really danger. That's an impending danger in terms of having a spike in the cases that we see in the states, or in the country rather. Since this is mostly like an interstate protest. I'll give you an example. When we had the unfortunate death of our area of Zaria, the mammoth count there, and we want there to be an active case search. Do a research there. Check people in hundreds and see what was the outcome, and also test people elsewhere and see what was the outcome. And really, the cases that were picked in Zaria and Southern Garudo Caucasus were alarming. So I'm just looking at a similar scenario after this MSAS, after the unfortunate injury, death that with notice that is happening in various states due to clashes, siblings, protests, and where the security men also have an pending hike in the number of cases of people that would come down with COVID-19. That's just unfortunate.
Okay, again, back home here in Kaduna State, we hear that testing is said to be carried on in the 23 local governments, and of course that again is to help the situation that we have back home. This testing again, what are we expecting? And would we be saying that we may be having a rise in it, as you're talking about what is happening in Zaria local government and some parts of Zaria?
Yes, the Kaduna State government has made efforts to ensure that we've increased the testing capacity of the state, and we have 4 standard testing sites in the state, and we are adding some equipment again that we will be able to test. It could test for tuberculosis, and it could test for COVID-19 and also some other diseases. And so the work is required to make them able to test for COVID-19. The state government has procured these cartridges, up to 10,000 cartridges, and we are able to configure some of these machines, and we are still configuring more to be able to test more cases. So in the 23 local governments, in the secondary health facilities, we have what we call the collection sites. Samples collected within the local government, whether they go to the community or people come to the secondary health facility, which is the general hospital, and get tested. The collection sites have been trained to package them and send them to the lab, designated labs for testing. So it's not testing in the whole 22 local government, but they are collection sites. So samples can be taken and people will be tested, and the results come quicker now. 24 hours.
Okay.
If you have any hitches, the result comes out in 48 hours.
Okay. Doctor, we have a situation back home now. Schools have been asked to reopen, and of course having our children back in school. Now, again, much as we're trying all we can to keep us safe from COVID-19, we see that with schools partially reopened now, again, our concerns about spikes in COVID-19. Your concern here?
So for schools, I know that before the schools opened, we had a strategy. Those that had symptoms, upper respiratory tract, whether catarrh, whether cough, they had samples taken and we were tested, just to be sure that the other people are safe. And no school was allowed to open without putting in measures to protect other people's students. So what we have agreed is that all the key staff were taught on how to screen, how to see their students and know which one should have further screening and investigation based on the step-down criteria and guidelines. So those staff were trained to be able to screen and bring out those people so that they will be tested. If we see anybody that's having catarrh, let's have them tested, let's know. And then where that person will be kept will be isolated, not together with mixing with the others, but kept in a corner so that we would mix freely with the others and even infect them until when the results are out. So that was put in place. Don't forget that other infection prevention control aspects were also put in place. Hand washing facilities were put even before you enter the school. Testing with the infrared thermometer were put even before you enter the school, and also face masks for all students, pupils, and staff before even you enter school. So that was actually put in place. And it's not all schools that were opened for Kaduna State. I know the federal government said schools can open, but depending, there's a caveat there, depending on the peculiarities of the state and the measures they have put in place with regard the citizens of the state. So Kaduna State has not opened for schools, but schools
not fully open.
Not fully, yes. Yeah. Schools that exam classes were open so that those exam classes would can have their exams at the same period with other people in the street, or even West Africa if you're talking about the Iraq. So the other thing is that Kaduna State have given the Ministry of Education approval, or have requested from the Ministry of Education, to have a plan on who opens first. Then every two weeks we'll have another set. When we are sure that these sets that have opened have been contained, measures have been put in place, we are able to control them, then another set opens in 2 weeks. So we are supposed to bring out a schedule. And to my understanding, that schedule is not ready yet. So until that schedule is ready, you may not see here Kaduna State opening for other grades of classes, other classes in Kaduna State.
Okay, Dr. Neyu, let's go a little bit global now. Again, it's been said that this part of the world, we have just been very lucky, and of course our doctors are still finding out why we're so lucky in this part of the world, and that the way it's ravaging other parts of the world, even with their standard facilities in health, they are still, on top of on the list. United States of America is recording over 200,000 deaths now. And of course, you come back to France and Britain, all of that, spiking on. But again, back home here, NCDC has warned that we must, stay with the protocols. And of course, but this we see are not being observed. Now, when you make comparisons, with what is happening in some parts of the world and back home in Nigeria, where we're having health challenge, so to say, in terms of facilities and personnel. How lucky have we been with the COVID-19?
Well, I would say that we are extremely lucky, because if you consider our health infrastructure, it's not nearly as comparable as what they have out there. Because if it is, then we won't be having all these medical tourism, people going out to have different kind of treatments and all that. So the death is advanced, and they have more deaths than in Ghana, so I think we are extremely lucky. I believe that researches have been going on. People are not really clear how come we have less severe cases than what it is out there. So a lot of theories have been postulated in terms of the strain is different, the strain is weaker, it's the malaria or drugs for malaria that's weakening it, and so many theories, but none has been proven to be the reason. So we thank God, because if we had had the condition being as severe as it is, with other parts of the country, I think it will have been a disaster. So yeah, we are extremely lucky.
Okay, well, again, let's come back home here again. Well, we talked about the schools. We also have our markets, fully opened. Areas where government showed concern, all up on for business now. With the transport system, we see our buses, are not, measuring up with the protocols. Now the buses are fully packed, and of course, face masking, which is one of the things that we must keep to. All of that, we're letting off our guards on these measures. And so your appeal this time, and the reality of COVID-19, if you could just emphasize on that for our, all our audience here.
Yeah, so I couldn't share with us properly, but I share that you are talking about markets are open, and the buses are not really following the protocols which have been put in place to protect citizens. That I have noticed. Buses are becoming, people are becoming more and more complacent. People are becoming more and more careless. Some are even saying that COVID-19 has gone and all that. That's just misconception. Because we are easing out doesn't mean that the disease is no longer in the populace. The disease is everywhere. Markets were opened because we need to do transactions, food, buy food and other things to survive. So markets were open, but if you remember, markets were opened with conditions, and those conditions include putting all these safety protocols. People should go out of if you are going out of your house, you should have a face mask. If you touch anything or anyone, wash your hands. Even the markets, they have a hand washing area where they go and wash their hands and touch like that. So that has been put in place.
Dr. Ilasu,
in the major market.
Okay, Dr. Deyu, this is a question that I just must ask, and that's about we have become so daring, even in the face of COVID-19. I'm saying we have become even more daring, so to say, and could you adduce your own reasons for that? Why, yes, COVID-19 is a reality, it's with us, but we've become so daring to it, facing it as it is, and saying, whatever would come, or whatever will happen. Why have we become so daring in the face of COVID-19?
So now this is a personal opinion, and by my personal opinion, I feel that people we around here, the country, a lot of us are not as caring as we should when it comes to health matters. That's just it. The issue of how to protect ourselves from this is just about behavior change. Just change our behavior and we'll be protected. But to change that behavior has been difficult for us. Other countries have done it. And they are far much better than what they were before. What we have now, we want to be better than the state that we are. Because all these protective measures and even the behavioral change will not protect you against just COVID-19. It will even protect against other diseases. It will protect against other contagious diseases. So, other communicable diseases. So I don't know why, for any reason, why we don't pick such behavioral change seriously. Sometimes it looks like it's just being defiant. It's just being defiant to government, being anti-government. But then the measures are simple that we could invite, and then it will be better. We have less visits to hospital, less psychological and emotionally more stable, because we know that we have changed our behavior to be more more healthy. So, in my personal opinion, we here don't take health as serious as we should. And because we don't, we easily get tired or get weary of protocols or of measures that have been put in place to take care of our health. That's my opinion.
Okay, and again, I'm taking this from what the audience were getting from the audience, that leadership should be by example, that we see leaders or those that to emulate, from when we see them in gatherings, or they most times not in any way observing the protocols put in place to keep us safe from COVID-19. Again, have you observed that too? And what would you say when it comes to leadership setting an example?
Well, I see that on TV in our meetings. We make sure that happens. We had a meeting recently with high-level government officials, and we had to refuse to commence the meeting until all the protocols for social distancing have been put in place and masks have been put in place. So it's just a matter of being insistent. You don't have to be at their level, but sometimes people forget, depending on prevailing situation. But then, I think, yes, I agree. Leadership by example. People, when they go out, people, when we have meetings, when we do deliberations, when you should follow all these protocols. And I know that other NGOs that are not health related have been having such challenge of leading by example. But for health and other ministries, affiliated to health, I know we don't have that issue. So I think it's one of your duties and our duty, everyone's duty, to call out to everybody, even in leadership, to lead by example. And mind you, if we don't lead by example, if we know what is right, we should do what is right. Those people that we feel that we should lead by example, they have all the resources to have the best healthcare possible.
Just before we close this segment of the program, I just like to put this across. It is, where again we're falling short of our fight against COVID-19, and that's talking about data. Other countries, developed climes of the world, know their deaths and know their births, and so could give figures that are, figures that are, near truth or could be just true. But back home here, we bury our dead, and of course, births are recorded, within the family, as we see every day. But again, even the dead, we don't have records of, cause of death, or, what you people call autopsy and all of that. And so people are dying in their numbers, and we do not know the reason for this death. Our concern is to bury our dead. And so for this, again, the role of data, and why the figures that we may have cannot just giving us true picture of the level of COVID-19 in Nigeria.
Well, that's true. I agree with you, because there are cases that we have had that have been in the hospital at the point of death, and samples were taken at the point of death. Their samples have also been taken on corpses when you see, and then you are not able to take the sample and the person dies. We're taking samples. Once we hear the history, we see looking like the COVID-19, even from cops, we're taking samples, and a lot of them have come out to be positive. So, assuming that they didn't come to the hospital, they just buried their death, then what it means is that we would not know that it was COVID-19 that they had. So that's just it.
Okay, Doctor, we'll have to go for a break. We'll come back after this break. I would like to thank you for being with us up to this moment. The program is Perspectives, and is coming to you courtesy of the Kaduna State Ministry of Health. It is a public enlightenment program to keep you abreast of what is happening with COVID-19 in the state and, of course, in the country. Kaduna State Ministry of Health taking care of this. And Dr. Elias Neyu, Director with the Kaduna State Primary Health Board, and, of course, a member of the COVID-19 team in Kaduna State, with us by phone. We'll come back after this break.
Invicta FM.
Welcome back. It's the program Perspectives this morning, and it's coming to you on Invicta 98.9. And we're having this program courtesy of Kaduna State Ministry of Health. They are our sponsor this morning. Tuesdays and Thursdays, we have them. And this morning we're also having Dr. Elias Neyu, a public health consultant with Kaduna State Primary Health Care Board, and of course is also a member of the COVID-19 team in Kaduna State. And so we're talking about the situation in the state, and of course what is happening at the national level. I would like to thank Dr. Elias Neyu for giving us this time on the program. He has a very tight schedule as it is, but again has agreed to spare this time with us. And so we just may not be, taking too many questions from my side, but just going to what the concerns are from the audience there. What is happening in your area, and what are some of the things that you must bring to our notice or to government's notice about COVID-19 and what is happening in your area? So we just want you to meet us or get us on these numbers: 081 40989, 081 40989, or 070 87 800 989, 070 87 800 989. These are numbers to call to be part of this program this morning. We want to know what is happening in your area, and we want to also share your concerns on COVID-19. It's real, it's with us, and of course the concern of the state government and courtesy of the Kaduna State Ministry of Health is that we keep ourselves safe in Kaduna State. We've been lucky so far. But just before I take on your calls, Doctor. Hello, Dr. Eliasun.
Yes, I can hear you.
Okay, the lockdown was a terrible experience, for citizens all over, and that's one. We do not want to go back to that. Never want to go back to that. But again, are we, with the way we're going about, with ourselves on COVID-19? Are you looking at a situation where we must be very careful, or would have to go back again to the lockdown? Because again, we're talking about some countries of the world that have reopened for business, but have had to go back to lockdown. I mean, schools were reopened and again were closed again. So you see a situation like that, we do not want to go back there. But the way we're going about with ourselves, are you seeing us dragging ourselves there again?
Well, statistically, yes. I'm seeing cases are still increasing. Though for some time now, we can see for sure because testing is not being carried out as we should. We are not meeting the target that will actually give us significant information whether it's really the cases that we have are going down, or is it because we are not testing enough. So this has been a concern, and it was even raised in the national forum. Kaduna State, we are not testing enough. People are turning out to be tested fewer and fewer, and with that, we won't be able to make a significant decision. But so, in order to take us out from that uncertain area, we need to test. More people need to be tested, and more people need to go for tests, more people need to get their status, so that we know, yes, this disease is going on in our state. But then, if you look at what is happening socially, what is happening in our communities, especially when you go to the village. I was in the village in Zaya, and I was the only person with a face mask, and what children were saying, look at this one is coming with that thing for corona. It's coming with that thing for corona. It's not usual, but then in that village to see people with face masks. So if you look at all these that are happening, then you would know that it's only God's mercy that right now we are not on our own working ourselves in. Because there are conditions, there are illnesses that will come in so much magnitude that even you, if you go out, you won't go out. But the grace of God has made it that the disease that we have, the COVID-19 that we normally have, is not, I'm not saying that people don't get severe infection. People get severe disease. People die from this disease. We have had in Kaduna State alone, as of yesterday, we have 32 deaths so far from March that we had our first case to have. We have 32 deaths. But within those, again, we have had people that have been critically ill, that have been put in intensive care before they recovered. Nobody will want to see a relative of his or a friend of his going through so much distress, so much pain. Even before dying, we've lost even medical workers. We've lost doctors from this disease. They had the severe form and they died. So, if care is not taken, really, we will reach that extent. But
okay, Doctor,
I'm just happy that the strain, if it is the strain that you use or whatever it is, we are able to, in most majority of cases, resist infection. And remember that 80% of those that get this infection still go along without any symptoms. It's the 20% that have symptoms that is the issue, and 5% that have the severe form of the infection. That is the issue.
Okay, doctor, let's also look at our entry points. The trains are running now, and we have interstate travels, so to say, and all of these were things that the government was concerned about, and that when we had the lockdown, government was concerned about people traveling in and out of the state. But again, all that has been open. The trains are running now in full capacity, and of course, we're having interstate travels. Again, these areas, these entry points, again, are there areas of concern for you too, as we face?
So I at the beginning, if you recall, right, different states were at different level of intervention. Some states have put in lockdown, some have not. Some have started campaign about face masks and all that. Some have started enforcing that people would wear face masks, number of travelers should reduce vehicles, and even some states have even enforced issues on social distancing and all that. So because we are at different levels, it was not right to leave interstate border free for people to move in from states that have not even started putting measures, which makes them to be at a higher risk, to states that already have measures put in place and sort of controlling or making possible. So that was really. Now all states have put in measures. The whole country in unity in ensuring that this COVID-19 continues. Now, what we now know is that some states are taking it more serious than others. So I don't know, I'm not preempting, but that again is another foundation for further interstate lockdown, because if other states are not taking it serious and they are having cases, then it's an issue. I've heard that some states are not even testing. So if some states are not even testing, then how would you know what is the endemicity? How much of this disease do they have? They cannot know, and you cannot tell. So there are so many things that we don't know anyway about this disease. I'm just hoping that everything works out for the better. But for now, in terms of measures put in place, in terms of statistics, it's not looking that good.
Okay, doctor, we've had infected cases, in Kaduna. We've had people that have been infected and have showed face at the, facilities. They've been isolated, they've been treated, and some of them are back, to the society or into society. Again, the point blank question is that with one experience of COVID-19, if you've tested positive and you've been treated and you're back in your community, can COVID-19 reoccur?
Yes. So Kaduna State has had 2,569 cases so far as of yesterday. We have managed, and 2,478 have actually recovered from the illness. Others are still on treatment. So I told you about 42 deaths that we have had. Yes, people are getting treated and people are getting well and are getting back to the society. Yes, that is true. So initially when the COVID started, it was said that once you get well, you are protected for about 3-4 months. But we are having people now that come with the disease in less than that. Are you with me?
Yes, Doctor, what you're telling me is
that... I'll give you an example.
Okay.
For those that follow football, you hear that Cristiano Ronaldo had the disease, he got well, and he's having the disease the second time now.
Okay.
So if those at that level could have the disease twice, then so what other evidence do we need that it can happen even after you have the disease? So once you get the disease, you are not immune. If you get exposed, you can get reinfected with the disease.
Okay. Again, but let me just ask this again as part of it, that for those that you have treated or that have been treated in the facilities, have you had a record of, any one of them, coming back again to be treated?
Yeah. I mean, we had two cases of they had the infection and they become reinfected. Just two, really.
Okay. Okay.
So that doesn't mean that there are not more than 2. It's just that the ones that we kill and we capture as reinfection, that's just what we kill.
Okay. All right. Quickly, call us on these numbers: 081 40,000 989, 081 40,000 989, or 070 87 800 989, 070 87 800 989. Okay, we'll take your calls, take your questions, and of course take your observations too, and what we have to pass on to government. Dr. Elias Neyu on with us on phone this morning. Hello, good morning.
Good morning.
Good morning.
How are you?
I'm good.
I'm Clement.
Okay, Kenneth. All right.
Clement.
Clement. All right, Clement.
Yes. As regards the opening of schools, I want to beg the governor of Kaduna State. He should just come out plainly and tell us whether the school should resume without water running through our pipe. For the past almost 2 weeks now, no water anywhere in Kaduna. And we are telling the children to go back to school. Is this how we will continue to live in this town? No water, no water.
Okay, Clement, we got you on that.
Is this modern Nigeria? It's a pity in fact.
Okay, Clement. Again, Dr. Eliasu, here's the concern. A concern.
Yeah, I didn't get what you said.
No, he's saying that if children have to go back to schools, and of course, keeping them safe there, water, for washing of hands, and must be in place. And they were talking about a situation in the state where the pipes are not bringing out water. So, what are we saying here?
Yeah, I wouldn't know if pipes are not bringing water where I feel.
That's his observation, Clement.
Yeah, so but if his own place doesn't have water, how what have they been using? They were coming through the pipe and now they don't have water in the pipes. If that's the situation, then I think they should lay out a complaint so that the DG of the water can act on that.
Okay.
So is it that they never had water at all?
Okay.
If they've never had water at all, then there must be a source that they were using even before now.
Okay, Doctor, I have another call here. Hello, good morning.
Available?
Okay.
Good morning, Mr. Tony.
Good morning.
I'm Luca.
Okay, Luca, from what part of town?
Calling from Marabarido.
Marabarido. All right, let's hear you.
In fact, the convict protocol has been defeated. The essence is defeated.
How?
I said the essence of these convict protocols is highly defeated.
Okay.
Frankly speaking, completely people no longer observe these protocols. Get to our churches, even the clergy don't even put on their mouths, who are supposed to show good example because they are role model. They don't. Go to our schools, absolutely, even the teachers, they do not even, when the schools are open, none of the teachers you could see with these marks. Then get on our route. All the vehicles lying on our roads completely have gone back to the status quo. They are conveying the number they were conveying before the lockdown. And they are collecting higher share, that's transport share. Yet, passengers, nobody wears these marks. So it's like completely there's no these convict protocols. And nobody is observing it, so I expect the government at least to look for another way, at least to see that these convict protocols are being observed. Okay. Otherwise, in fact, we'll find ourselves in a due.
All right.
That is my contribution this morning. Thank you.
All right, Clement, thank you. I'll just come back to you, Dr. Eliasu. We're talking about compliance now.
So that is interesting. Compliance is an issue that's very interesting. Is it that people don't know that they should do 1, 2, 3, or is it that people are refusing to do it? My take is that people actually know, but people are refusing to do it. and they're blaming the government. We have to take responsibility ourselves. The community have to take responsibility. The community leaders will have to take responsibility. The religious leaders will have to take responsibility and do this enforcement. The government does not have to come with a heavy stick each time it wants things done for the benefit of citizens. The last time I remember, I was telling you about forward campaign, and the forward campaign are simple measures where we would just use and to protect ourselves. Know it and protect yourself. It doesn't have to be. The measures are simple. The forward is for us to remember easily. A face mask, which is a shield, which it stops the spread. So wear your face mask always. Once you leave your house, put on your mask. And you know that since before now. That's the F. If you remember, we mentioned O, which is the observe and keep the social distancing, 2 meters or 6 feet, whichever you are used to, or have 2 arms, stretched arms, not just touching each other. That's 2 meters, right? So that again, people know this, but then they collect a higher fee and put you in a car, camp you in a vehicle with many others, and you still accept it. Why are you paying a higher fee? So that you will have less people in the vehicle. Now they've collected the higher fee, the higher fare, and they are camping in the vehicle. You are not complaining. People accept it. So it doesn't make sense to me, really. The R for forward, FOR, the R is respiratory hygiene. If you remember, when they say if you are going to cough into a tissue, or if the tissue is not available, cough into what? Bent elbow. So that we know it has been out there. The cough hygiene is there. The W is wash your hands with soap and running water. And except that is not available, that is the preferred method. If the soap and water is not readily available, then you can seek for hand sanitizer to kill the virus if you have come in contact with the virus. So washing hands is very, very key, very, very important. People seem to be putting more emphasis on hand sanitizer. It is not the hand sanitizer that is better. The best is to wash your hands with soap and water and wash it properly. And then for the forward, you got FORW. Then the A said you should avoid large gatherings. Stay safe. So that was why, if you recall, even for burials, we have protocol people. We have protocol for gatherings not more than 20, and for places like worship places, not more than 50. And even then, they should have the safe distances among them. They should also have the hand washing equipment so that people can use it. They should have the face mask. But if you go to the worship, just like the person from Maribarido rightly said, you go to worship places and it's not like that. So I don't know when our churches, when our mosques have become complacent on the health of the people that come to their churches or mosques. I think we should be more responsible as a people, as a citizen, and ensure that people are protected. So the R in forward is to remain indoors, and you go out only when it's necessary. And even to keep fit, you can do even if it's exercise, you can do such things indoors. The exercise you can do indoors. And the D for forward, the last the D, which is diet, is essential. We should eat healthy food to keep ourselves healthy. So these are things that people know.
All right, Dr. Ney, let me squeeze in this one last call.
Okay.
Yes, okay. Hello, good morning.
Good morning.
Good morning. Your name and where you're calling from?
Thank you. I'm Steve Madu calling from Ibinusa Mando.
All right, Steve Madu, let's hear you.
Well, I love our guest and I speak very well. But I think to my own observation, I can say the government has not prepared fully to open schools. Because what I expected to see that our pupils that are going to school now, they should give them what we call correct and proper hygiene protection. Face mask and where they will wash their hands, I think should be put in place in order. But to my greatest surprise, I went to some schools to check, most especially where my children are going. Let me go and check what are the protocols they are following. I'm highly disappointed because you see the children no masks, the staff no face mask, and at the end, the two pocket they stretch and kept that people will be washing their hands. The children now going back and drinking that same water. I look at it and say, what? If government has prepared, they're supposed to put all these facilities in order where children will wash their hands and where the drainage will be proper drain, not falling on the spot where they are washing their hands. So meaning if the whole children go back with this thing, may God protect us. But truly, to me, they are not ready. So let them put this in order before calling back the children to the school.
Okay.
Thank you.
All right. Thank you. Dr. Neyu, you'd also react to that quickly, and our time is almost at the ceiling.
Yeah,
that's a concerned citizen from Do part of Kaduna.
So I had his concerns, and it's a genuine concern, really. He's saying the government should. That means he's putting the whole responsibility on government. But I am saying that it's our responsibility, all of us, both government and even the private sector, and even the schools involved. If the government may not be able to reach everywhere at the same time, but in the do. And I can't see that the school are handicapped in doing what is right, in ensuring that the students have water to drink instead of water that is kept for hand washing. So the government will do its part, the citizens should do their part, the community should do their part, and what the community should, what kind of schools, the community should rise up against those kind of schools and tell them these things are supposed to be put in place, and you have not put in place, you don't deserve to open your school. Government cannot be everywhere. So that's why I'm saying we should take responsibility. The government is taking its responsibility. The community should take its responsibility. Religious places, worship places should take their responsibility. We as individuals should take responsibility and be responsible in ensuring that what we need to do to protect our health, it's our health. We should take priority and make our health priority and do the simple measures of we shouldn't wait. I don't think we should wait for government to do everything in public schools, in private schools, in worship centers, in markets and all that. I think even us, it's a good thing that you're voicing it out. More people should voice out in where they say you've seen a school and what it has is not enough. Tell the school that you don't deserve to open. Get these things ready. You can even try them to take your people away from the school with the input measures. You have the PTAs should ensure that all these things are in place. You as a parent, you have a responsibility to ensure that the PTA are aware, and also you take responsibility to ensuring that the school does what is right before it opens to its pupils.
Okay, Dr. Elias Neyu, thank you for coming on the program.
Thank you.
Thank you. Appreciate. Okay, and that would just be about the size of the program Perspectives this morning. We're talking about COVID-19, the reality of it, and that it's still with us, and so we must all still stay with the protocols in place to keep us safe. The program is brought to you courtesy of Kaduna State Ministry of Health and Dr. Elias Neyu, a public health consultant and a director with the Kaduna State Primary Health Care Board, sharing thoughts with us on the situation back home in Kaduna State. We'll come back with Perspectives tomorrow, same time, same station. To thank Martha Olariman for connecting us with the people, and Wisdom for putting us in the pictures. Good morning.